Good morning. For most of human history, it has been considered obvious that the way we determine whether people are male or female is on the basis of their bodies. Today, the transgender movement claims that the mind takes precedence over the body when it comes to determining whether a person is male or female. This, however, is an ideological assertion. As Gil indicated, it is not in any way a scientific one. It is troubling when an adult adopts this transgender ideology, but it is tragic when a child falls victim to it. Our first two speakers on this panel today are leading national experts in the science and medicine of this topic. And our third one will address what our response should be as parents and citizens. I'm going to keep my introductions brief, but I encourage you to read their impressive bios in the program. Our first guest is Dr. Paul McHugh. He was director of the Department of Psychiatry at Johns Hopkins University School of Medicine and psychiatrist in chief at Johns Hopkins Hospital from 1975 to 2001, but he is still actively practicing medicine. In 2016, he and his colleague Lawrence Mayer co-authored a special issue of the journal The New Atlantis, which served as one of the best summaries of the research and science on both sexual orientation and gender identity. Please give a warm welcome to Dr. Paul McHugh.
Thank you very much, Peter, and for that introduction. And I hope you do read the New Atlantis article. It's a very long one, though, and it's full of data and very hard to read, I think, as I review it. It was just necessary to put it that way. And for this panel today, I was asked to talk for about 10 to 15 minutes just to sort of set up the issue for you to know what we're seeing, what we're thinking about, and what's really happening in this whole world of transsexual, transgender, gender dysphoria, gender identity disorder, all these different words that are being used all pretty much for the same thing, and that have now spilled into the treatment and the approach to children in a very distressful and in my opinion, ultimately very injurious way. I really began studying these cases when I was head at Hopkins of psychiatry, because at that time it was mostly adult men who had various kinds of reasons they themselves were excited to think of themselves as females. And now this has spilled over to a whole ideology about children and about human nature that is the subject today. Now, I want to make a few simple points before you hear from Michelle Cretella, the distinguished pediatrician. And that is, first of all, that gender identity disorder and its accompanying gender dysphoria, which are the terms right now that are being used, is actually a disorder of assumption about one's condition and one's nature. A disorder of assumption, therefore, is of interest to psychiatrists. We're interested in people's ideas about the world, especially with the ideas about the world that are unrealistic. But as a disorder of assumption, gender identity disorder falls into the class of psychiatric conditions, a lot of psychiatric conditions that we're very familiar with, including anorexia nervosa, bulimia nervosa, and body dysmorphic disorder. That is, in those cases, the person feels that the body is not what it should be in some way. The anorexic thinks, and it's usually a woman, thinks she's fat when she's starving herself down to an emaciated condition and runs the risk and the danger of losing her life from starvation. And we were very familiar with this kind of disorder and helped the patient, not by going along with her idea, by making her more thin, but by encouraging her to see that the problems were what she's thinking rather than what is real. Similarly, body dysmorphic disorder is a disorder in which somebody believes that some aspect of their appearance is so ugly that it needs to be surgically corrected, or won't go out of the house because of the way they believe that they look. The most distinguished person who had body dysmorphic disorder, you may remember, was Michael Jackson, the singer. Michael Jackson felt that his Afro-American nose was too ugly. He wanted to have a more Anglo-Saxon nose, and he had multiple surgeries until ultimately all the cartilage in his nose was destroyed, and he had to wear an artificial one. It also introduced him to the pain medicines and the pain cares that ultimately led to his death. So you see, this is what we mean by a disorder of assumption. The idea in the person's mind that something about the way they are is wrong, and ordinarily, and previous to the gender dysphoria business, we worked not to affirm their belief, but to help correct it. Now, the surgical and hormonal treatments now being proffered for gender identity disorders are experimental procedures. They are not evidence-based procedures. We are now working to give children, particularly, hormones and even surgery that we are not sure they're not is the best for them. We are not. The scant data that is available for these treatments of hormones have been described officially in the literature as evidence of very low quality. This kind of of title to evidence, you wouldn't use an aspirin if it had that kind of low quality. And here we are changing lives. And it's really, here is an experimental medicine, experimental treatment being used with many people, both adults and children, by the way, and they are proceeding without the usual backup suited for we do experimental medicine all the time, after all, in the care of patients with cancer and patients with certain forms of heart disease. So it's not unusual for us to use experimental medicines, but we do it with several clear constraints. First, there's always with experimental medicine Institutional Review Board oversight, the so-called IRB oversight, in which both lay people and doctors look at everything that's being done for a particular course of treatment and study it as it goes forward. Also, the patients and the families that are being treated this way have to have informed consent that clearly explains to the patients and the family the experimental nature of the treatments being offered to them. They have to be told, look, we're not sure. We hope that we might help you with this, but we're not sure of the outcome because we are, and you are, part of an experiment. And as an experiment, there should be comparison treatment groups being followed along with less rigorous treatment. There should be, for example, with all of these studies, a psychological treatment rather than simply a physical and surgical treatment. So in the early 1960s, 1980s rather, at Hopkins, we psychiatrists and plastic surgeons who had actually started this treatment of sex reassignment surgery because back in the 60s, John Money, who was a member of the department there, thought that that was the best way to treat them. But we did realize that it was an experimental treatment, and after 10 years, we did a follow-up study of the treated patients and compared them with the non-treated patients and discovered that they were receiving very little psychological help from the surgery. Now that, when I say that to people, they say, well, were they happy or not happy with it? Well, about 2/3 of them were happy with it, but we weren't doing it to make them happy. We were doing that surgery because we were, and treatments, because we were told by them that their work relationships, their family relationships, their interpersonal lives were affected because they couldn't live the way they wanted to in the opposite gender. When we went to study them 10 years later, we discovered that there was no change in those various features. They were just as unhappy at work, just as unhappy in their relationships, so we thought that we weren't doing them good, and we stopped doing it. That was only a 10-year follow-up. A larger and longer follow-up, a cohort study from Sweden, was reported in the last few years, has demonstrated that sex reassignment surgery patients suffer suicide rates, along with other evidence of psychological problems, some 20 times greater than their peers. Okay? The surgical patients died from suicide 20 times more frequently than did their comparable peers. It wasn't a comparison study, it was a cohort study. It was just following them along. And it turns out, if you look at that data, which you can find in that article of mine, people are okay for about 10 years after these surgeries. But then, after that, then these great regrets and even death from suicide begins to occur. It's as though you get a 10-year period in which you're satisfied, but then begin to realize what has happened and the kinds of things that have closed off in your life. And there are no more optimistic long-term results are available than that from Sweden. So I've talked to them, it was very interesting. I talked to some dermatology friends of mine, and they said, it's very interesting, 10 years, that's about the time that it takes for you got disappointed with a tattoo. The long-term evidence of a short-term feeling, which is what a tattoo is, lasts about 10 years. And they were very interested in that. So not only are we doing experimental medicine, but we're doing it in the face of some evidence that the long-term outcome would be disastrous. The recent increase in gender identity dysphoria amongst children and youth, which is part of what Dr. Cretella is going to talk about, does not represent the recent discovery of overlooked victims, but rather a form of social contagion. These kids are being affected by the internet, by their peers, and even by the sex education programs they've got. This kind of social contagion is very, very common amongst the disorders of assumption. It's really how anorexia nervosa got rolling. It used to be said that you didn't have anorexia nervosa until Vogue magazine appeared in the culture. And it might be right. But the culture and peer suggestions have evoked the sense of gender misdirection, or gender misplacement in young people suffering from many other different kinds of personal and emotional concerns. They have many other illnesses that make them vulnerable to this kind of social coercion. These vulnerable youngsters are not being thoroughly assessed psychiatrically. It is amazing to me. I get 2 or 3 calls from families around the country every week in which they're saying, my child for the first time began to think he was a girl, but when I take him to the doctor, he doesn't examine him for the depression that he had before, for the abuse he suffered before, for the kind of introversion that he had. None of that is being studied. He's being pushed directly into hormonal treatment. Is that the right thing, Dr. McHugh? And I said, absolutely not. They must look for them. If these subjects, these young people, are physically treated, they will, with hormones or even surgery, they will in time suffer serious regrets and resentment, leading to courtroom entanglements of the kind seen when medical misdirections take on this social energy. It's just as though in the past, the world of frontal lobotomy and other kinds of, you probably remember the other craze of misdirected craze, the multiple personality things in which so-called recovered memories similarly resents, will be in the courtroom sorting these things out. So these I think are the material that I want you to understand about these matters, and Dr. Cretella now is going to tell us what she's learned as a pediatrician in the face of this ideology and misdirection of treatment. Thank you very much.
I'll just stay right here to save a little time. Thank you, Dr. McHugh. Our next guest is Dr. Michelle Cretella. She is the Executive Director of the American College of Pediatricians, not to be confused with the larger and more politically correct, but not more medically correct, American Academy of Pediatrics. I would encourage you to check out their website at acpeds.org. That's acpeds.org. Dr. Cretella herself is a mother of 4. Please welcome Dr. Michelle Cretella.
Thank you. Thank you very much. America is engaged in large-scale child abuse. And complicit in this is my field of pediatrics, psychiatry, our education system, mass media, social media, and this is being enacted in law now. I want to go over a few things, just basic facts, because from our side, we don't want to use the other side's language. Language is key. People have a biological sex, and that's it, period. We don't have something additional to that called a gender or a gender identity that is hardwired into our brain or hardwired into our DNA. And to understand why the other side will throw out, oh, we have functional MRI studies. They are meaningless. And you can find out why by going to the Atlanta journal that Dr. McHugh and his colleagues published. Human sexuality is binary. It's implicit. It's in every cell of our bodies. We're either 2 X chromosomes or an XY. Sex is not assigned by people. I don't assign sex to my patients when I see them in the delivery room. It declares itself. We recognize it. Our bodies tell us who we are. What about intersex conditions? And with the emphasis being conditions. These are disorders of sexual development. They are very rare. They do not prove that there's more than one sex. About 1 out of 2,000 babies will have genitalia that may be indeterminate. They require medical attention, totally separate from the transgender condition. Our identity, recognizing whether we are male or female, is something that develops over time, and it's learned. Dr. Kohlberg was the psychologist who outlined this for us. Children very well, most of them do know, I am a boy or I am a girl at age 3, but that doesn't mean that they know sex doesn't change. In fact, it's not until age 7 that most children will understand if I dress in a dress, let's say in other words, under 7, they may see a boy or a man put on makeup and get into a dress. Children under 7 may think they just changed their sex. Now, what about teenagers? Is it surprising that we see teenagers adopting this identity more often? Heck, that's a teenager's job. Teenagers are figuring out who they are. They're trying out different roles. And what is our society doing? It's holding up the transgender identity as the coolest thing, the cure-all. You know, oh, adolescents, teenagers, are you feeling unhappy? It's because you're trapped in the wrong body. As Dr. McHugh said, there are many conditions in which people have false beliefs. As he said, some believe that they are terribly scarred. We don't send them for cosmetic surgery. Others believe they're morbidly obese when they're actually thin as a rail. We don't send them for liposuction. And another disorder, there are individuals who believe they are disabled and trapped in a normal body. They will seek out surgeons to amputate limbs. A transgender individual, similarly, right, it's just a different body part. If they may want to amputate breasts that are healthy or amputate genitals that are healthy. But medicine says, you know, the problem isn't in the mind. I mean, this is the latest. Without any science now, medicine and psychiatry are saying, oh, no, these people are born this way. It's not a problem of the mind. It's actually a problem of the body. We must change the body, even in children, to match their false beliefs. And parents, if you don't affirm your child as transgender, they will grow up to commit suicide. This is why I call it institutionalized child abuse, because now if you have a child who, even as young as 3, is confused about their sex, you are going to be told you must change their name, change their dress, introduce them at school as the opposite sex. And in the process, you're also indoctrinating all other children without the confusion. Chemical impersonation of the opposite sex is next, and that is when doctors prescribe puberty blockers and cross-sex hormones. Surgical mutilation, a girl who thinks she's a boy may be referred for a double mastectomy as young as age 13. Genital surgery at the moment is not allowed until age 18, but surgeons who are involved in this field are trying to push the age range lower. Step 1, indoctrination. Again, largely through social media, but also in the schools. There are numerous books such as I Am Jazz, The Red Crayon, multiple books that are gender bending that are read to preschoolers. Now, oh, moms and dads, please take your preschoolers and kindergartens to the public library where they can be read to by drag queens and further confused. I want to call your attention to the young woman in this slide. Her name is Alexis Lightcap. She went into her high school girls' bathroom, found a boy. She ran out. She told the teacher. She was the one who was in trouble. There is a young man in the picture. He's running, and behind him is another in a red shirt, and there's a young man in the black shirt behind him. Well, they are trans girls. They are biological boys, identify as girls, and they just ran away with the top honors in the Connecticut girls' state track. Transgendering a child, step 2, block them, block that puberty, stop that puberty. Age anywhere between ages 9 and 12, what are we doing? Okay, you put a child on puberty blockers that young and then introduce them to a sex change hormone, they're permanently sterile. We are also stopping, it's not just the body that doesn't develop, it's the brain. So we're interfering with their brain development. Lupron does have FDA approval to treat prostate cancer in men and to treat endometriosis in women. So what happens when it's used appropriately? The adults have memory problems. So what are we doing to these normal, physically healthy children? And again, when Lupron is appropriately used, it has been found to have risk of severe bone fractures, weak bones, possibly an increased risk of testicular cancer in boys and obesity. What do sex change hormones put the kids at risk for? And remember, for the kids to be transgender, they will have to be on these sex change hormones for life. So again, sterility, heart attacks, high blood pressure, strokes, these are not minimal problems. Cancer risks, and even emotional instability, which the hormones are supposed to be helping with. Transition, as you heard, does not prevent suicide. This, in Sweden, which is totally not transphobic, right? As you heard from Dr. McHugh, the transgender adults were followed out for 30 years post-surgery, and their suicide rates were 19 to 20 times greater than the general population. What we are seeing, as Dr. McHugh alluded to, is a skyrocketing of children anywhere between the ages of 3 and 19, just skyrocketing in terms of identifying as transgender and showing up to these clinics, especially the girls. And this is happening all over the Western world. This particular slide shows that in the UK alone, the rate of girls presenting to these clinics has increased by over 4,000% in roughly a decade. go forward. Okay, we'll skip. So what is this that we're hearing? I'm getting a lot of questions. You know, the American Academy of Pediatrics has just come out with a policy statement claiming that we must affirm these children. They're born this way, and we want to prevent suicide. Did 67,000 pediatricians really back this statement? Well, we don't really know because only 36 actually voted on it. 36 pediatricians contributed to the statement and then voted on it. And this is virtually what happens in every national medical or psychiatric guild. The policy statements are written by experts and then voted on by the board of directors. So the membership at large does not have any input. And in the case of the American Academy of Pediatrics, we find out about their statements 24 hours before it's released to the media. So I have a few examples of the thinking and ideology of leading pediatricians in the nation. Dr. Deanna Adkins is at Duke University. She is the director of their gender clinic and says, you know, from a medical perspective, gender identity determines sex. Chromosomes, hormones, body parts have nothing to do with science or sex. It's all what you think. Here is a psychologist, Dr. Diane Ehrensaft, founder of the UCSF Gender Clinic. And you have to understand, they are leaders in the field. They are training, they are determining what is taught at medical schools across the nation. She actually encourages parents and teaches children, you've got to tell your youngsters, preschool sons and daughters, that some boys have vaginas and some girls have penises. And if they ask you, Mommy, is that person a girl or a boy? You should tell them, oh, you're gonna have to ask. Because you're a boy once your brain tells you you're a boy. And she has actually said, she's actually taught parents that pre-verbal children, so ages 1.5, 2 years old, they send gender messages. You know, for example, a 2-year-old girl who's throwing a tantrum and rips out her barrettes, she may be telling you that she's trapped in the wrong body. And this is the last example I will give because it is so incomprehensible to me that a woman would make these comments. Dr. Joanne Olson Kennedy is married to an individual who is biologically female and transgendered over to male. Some may see that as a conflict of interest. Dr. Kennedy, who heads up the clinic at LA Children's Hospital and is one of the head leaders of an NIH study in observing these transgender children, tells the story, and I believe it is still available online, in which she had an 8-year-old girl in her office who was a typical tomboy. She preferred dressing in pants, boy clothing, and she was very athletic and was getting some bullying at school. So Dr. Kennedy asked her, well, are you a boy or a girl? And the 8-year-old girl looked at her like, girl. So Dr. Kennedy said to her, well, what if I gave you a Pop-Tart wrapped in a strawberry wrapper and you bit into it and it was blueberry flavor? What kind of Pop-Tart is it really? And the girl said, well, blueberry. And then the little girl's eyes got big and she said, looked at her mom, Mommy, I think I'm a boy in a girl wrapper. And Dr. Kennedy was encouraging her audience of students and physicians, saying, now I didn't make this girl believe anything. I just gave her the words to express himself, right? And more recently, she has come under criticism for sending 13-year-old girls for double mastectomy. She came under criticism, and her response was, look, if you change your mind later, you can just go out and get some.
Oh,
I don't know, maybe she needs to speak to some breast cancer survivors. And it gets a little worse. Legally and medically, these activists are banning therapy that would affirm biological sex. They have succeeded in 14 states and here in Washington, D.C., and 44 counties across the country. This basically forces children into being affirmed as transgender. And my last slide, which will segue into Elizabeth Johnston, is that if individual beliefs trump reality, our First Amendment rights are gone. No parent rights, no religious rights, no girls' and women's rights, total erasure. So we need to stand up not just for the sake of our children, but for our very most basic liberties. Thank you.
Thank you. Thank you, Dr. Cretella. Our time is very limited, but I wanted to mention someone in the audience today who we could not add to the panel, but Cynthia Dunbar has founded the National Resource Center for Education to help conservative parents, teachers, and school board members fight back. Cynthia, are you in the audience today? Can you stand up? She's here over at the left, so she can give you information about that organization and how you can get involved. Well, our final speaker is named Elizabeth Johnston, but she is better known as the Activist Mommy. You can read her blog and see her videos at activistmommy.com. Please welcome Elizabeth Johnston.
Thank you. Thank you so much to Tony and FRC for having me on a panel really with two of my heroes. My husband is a medical doctor as well, so I know what you have sacrificed to not drink the progressive Kool-Aid, and I greatly admire you for that. I am not a doctor or a lawyer or a political strategist. I am a simple mom who is concerned about the country that I am handing down to my children and grandchildren. And I've been tasked with the job today of giving you hope, sharing success stories of how everyday American citizens, moms and dads, can push back against this progressive agenda to blur gender distinctions. If you haven't noticed, we're not living in the days of Leave It to Beaver anymore. Just a few recent headlines. A child in Ohio was stolen from her parents because she believes she's a boy, and her parents didn't want her to undergo dangerous, non-FDA-approved drugs to change her sex. A law in Delaware would allow kids to change their gender or race with which they identify at school without notifying parents. A website called Trans Kids, which is so vile that VVS has had to block out the pictures on the website, sells penile prosthetics to gender-confused kids. Yes, you heard that right. They're selling private part gear to young children in middle and elementary school. No, you have not woken up in the twilight zone, and yes, the world has gone stark raving mad. I decided that I was fed up with just being outraged. Outrage without action is ineffective. I had to do something more. For instance, I picked a fight with one of the largest bureaucracies in our nation, the public schools. When I learned that they were teaching graphic gender-bending sex ed, we launched Sex Ed Sit Out. Thank you. A grassroots, truly grassroots movement of mama bears to fight graphic gender-bending sex ed in schools. Now, since schools weren't listening to parents, and since you lose money per day, per child when kids are absent from school, we said, fine, we'll hit them in the wallet. Mind you, I'm one woman. I have no big organization funding me or providing resources, no staff. But in a couple short months, Sex Ed Sit Out grew into a global movement in 4 countries. The media picked up the story. Rush Limbaugh talked about us for over an hour. Franklin Graham encouraged parents to sit out with us in protest. Parents pulled their kids from school en masse in America, Canada, Australia, and the UK. I've received messages from parents all over the world saying that 60% of their school sat out on April the 23rd. One mom in Sacramento wrote that her school, and she knew this because her brother-in-law was on the parents committee, her school lost $100,000 on April 23rd. Do I have to stop already?
Unfortunately, yeah, they said we have to stop because of the vice president.
Okay. Okay.
I'm so sorry. We've been informed that we cannot go over our time by even a little bit because the vice president is not going to be kept waiting. But I do urge you to check out the websites that I've mentioned and to check out activistmommy.com. Thank you, Elizabeth. Thank you all.